This is the materials we need to use. Good morning, my name is Chester de la Cruz, and I will demonstrate properly how to wear surgical gown, mask, and how to do open gloving. So our first step is we should wear our surgical hat and our mask so that the virus wouldn't contaminate to our face or hair. After we wear our mask, we should prepare our soap and running water and nail brush because we will do the proper hand washing. The first step of hand washing is to open the faucet and check if the temperature of the water is warm so that the will microorganisms would be cleansed. After checking the water temperature, we should pour soap into 4 ml or 6 ml so that the microorganisms in our hand will be replenished. Wet the hands thoroughly by holding them under the running water and apply soap to the hands. This time, hold the hands higher than the elbow, letting the water flows from the finger tips to elbow so that the hands are cleaner than the elbows. The rationale for this is the way the water runs from the area that now has fewest microorganisms to areas with a greater number. For major operation, long scrub is required. The duration of scrub should be 6 to 7 minutes for each arms. Scrub the nails of hands for 30 strokes. Scrub each side of each fingers for 20 strokes. Scrub back of hands for 20 strokes. Scrub palm of the hands for 20 strokes. Scrub forearm for 20 strokes and repeat the same steps for the other hand. After washing and rinsing, use paper towel to dry one hand thoroughly in a rotating motion from the fingers to the elbow. Use a new towel to dry other hand and arm. The rationale is moist skin becomes chapped readily, as does dry skin that is rubbed vigorously. Chapping produces lesions. Discard the paper towel in the appropriate container. Next step is we should put on the sterile gown. Grasp the sterile gown at the crease near the neck. Hold it away from you and permit it to unfold freely without touching anything including the uniform. Put the hand inside the shoulders of the gown and work for the arms part away into the sleeves without touching the outside of the gown. Since we are doing a downing of sterile gloves using a close method, work the hands down the sleeves only to the proximal edge of the cuffs. Have a coworker grasp the neckties without touching outside of the gown and pull the gown upward to cover the neckline of your uniform in front and back. The coworker then ties the neckties. Proceed to the close gloving. Turn the gloves in an upside down where in left is at the right side and the right is on the left side. Put the glove on your dominant hand. Make sure that your hands will not go beyond to the sleeves. Then, after adjusting the gloves, pull the gown for the gloves to fit into the hand. And then, do the same on the other hand.